This bill, it is the highest level of opposition to date because more and more people are seeing and learning the truth about what's being proposed in the bill before the Senate right now.
Could I finally ask, this is the information on the bill as it is, correct? The one originally, this is without the expansion of Medicare taken into this study, which already, as you quoted the New York Times and other healthcare experts, is going to increase costs even more as you expand Medicare, and you run among other things, you run the risk of adverse selection, which means the people who are the sickest immediately enroll, which then increases the cost. And then who would be paying increased Medicare payments? The young and the healthy. Should we do that to next generations of Americans, I'd ask my friend from Wyoming?
Well, we should not. We need to be fair. We need to deal with this in a realistic way. But the bill in front of us now is going to raise taxes, $500 billion. It's going to cut Medicare by almost $500 billion for our seniors who depend upon it. And for people that have insurance that they like, it's going to increase their premiums. They're going to end up paying more than if no bill was passed at all. And that's why across the board, more people would rather have this Senate do nothing than to pass this bill that we're looking at today, because they understand that the impacts on this nation and our future are devastating. They will cause us to lose jobs with the taxes. They will cause us to lose care in small communities. And for our seniors who depend upon Medicare, they're going to throw more people onto Medicaid, another program where half of the doctors and half of those folks can't find a doctor to get to see them. So all in all, there is nothing I see around about this bill or any of the new changes, and certainly this report, nothing says to the American people, hey, you might want to think about this. The American people have thought about it. This report tells the American people this is not what you want for the health care of this nation.
Madam President, I'd like to ask unanimous consent to include in the record the first 20 pages of the report of the Centers for Medicare and Medicaid, and ask the senator from Georgia. While this is a complex document in many ways, it's a matter of common sense, isn't it? I mean, if you take a program that's going broke, and if you take $1 trillion out of it, and if you add millions of people to it, I mean, isn't the end result there's not going to be somebody left to take care of the patients who need help? Isn't that the logical result of that, just as this report says?
Not only does that report say that, but as you say, common sense ought to tell you that, but unfortunately, it's pretty obvious that the folks on the other side of the aisle that are promoting this bill don't get that message. And let me just quote the chairman of the Finance Committee, who today issued this statement relative to the CMS report that you have in your hand there. He said, and I quote, "The report shows that health reform will ensure both the federal government and the American people spend less on health care than if this bill does not pass." Now, that statement is directly contrary to the statement in the report that you just referenced, which says from CMS, and I quote, "We estimate that total national health expenditures under this bill would increase by an estimated total of $234 billion, or 0.7% during calendar years 2010-2019. And not only that, but the report says that the national health expenditures would increase as a percentage of GDP from 1 out of every $7, which is about 16%, to 1 out of every $5, which is 20%. So what the report concludes is that not only are health care costs going to go up, but as the senator from Arizona said, 20% of all Part A providers, nursing homes, hospitals, home health would become unprofitable within the next 10 years as a result of the provision in this bill relating to the Medicare cuts that you just talked about. The American people do get it. That's why these poll numbers that the senator from Wyoming just stated coming out of CNN, and why the Fox poll that I saw this morning said 57% of the people in America are opposed to this bill. The American people are getting it, but for some reason our friends on the other side of the aisle are not.
Mr. I see the senator from Nebraska, and we were having a conversation a little earlier about the attitude of the people in Nebraska. It's very helpful to have independent evaluators who tell us that if you cut $1 trillion out of a program that's going bankrupt and add millions, and then add more people to it, that doctors and hospitals are going to go broke. But we've heard that before from the Mayo Clinic, and I think you've been hearing that in the state of Nebraska.
I've heard it all over the state. You know, today, let me just say, the fog cleared. The fog cleared. And the sun is shining brightly on this mammoth experiment with 16% of the economy. And this actuary says very clearly, he's got no axe to grind with anyone. He just says very clearly that costs are going to go up under this bill, that care is going to be jeopardized under this bill, that the very linchpin, the essence of what this bill was supposed to be all about, can't happen. Now, if I might just, with unanimous consent, offer something for the record, just to put some perspective here. I want to applaud my colleagues on this side, and here's why. We wrote to the majority leader back in the first part of November, and we said that CBO had not been able to tell us what the ultimate impact would be on health care costs. And we felt strongly that we needed a second opinion. And so we asked that this bill be submitted to scrutiny by CMS. And that's what we're getting today. 24 of us signed on to that. And with unanimous consent, Madam President, I'll submit this for the record, that letter.
Without objection.
But today we finally have come to grips with the fact that all the promises made are not being fulfilled by this bill. That the $2.5 trillion that will be spent will really accomplish nothing. That health care costs won't go down, they will in fact go up. That people will lose their private insurance. And I tell you, the most heartbreaking thing for me and any other senator who has rural hospitals, which is just about every senator, the most heartbreaking thing for me is that 20%, as the gentleman from Georgia points out, will be underwater. That's nursing homes that care for real people. That's hospitals that provide services for real people. And I would tell you, in a state like Nebraska, when hospital care disappears in a small town, that may mean hospital care disappears for hundreds of miles.
And if I could ask the senator from Nebraska, did not just a rural hospital in Nebraska or Wyoming or some state, did I not notice that in the Mayo Clinic letter this week, they said cuts like this or expansion of Medicare under these circumstances would cause them to have well, Medicare period, they lost $840 million this year. And they're beginning to say to some citizens from Nebraska, Montana, other areas, we can't take you if you're a Medicare patient or if you're a Medicaid patient.
Yeah, what this bill does, and they are saying that, and that's what's happening, because they're losing money on, they're definitely losing money on Medicaid, they're losing money on Medicare. So what the Reid bill really does here is it says, Mr. Alexander, you sell whatever, cars, let's just use that as an analogy, and I know you're losing $100 on every car, but let's just give you twice as many to sell. Well, you're going to lose twice as much money. And that's their solution to the healthcare crisis in this country. But what this actuary points out, what the Mayo Clinic points out, what so many analysts now have pointed out under this bill is that this is going to put hospitals under, it's going to put nursing homes under, and here's another point that kind of gets lost in this complex debate. That nursing home or that hospital may be the only major employer in that community. And when you lose that, you not only lose your medical care, but you lose those jobs. I've said on the floor before, this bill is a job killer. It is a job killer. There's just no way of getting around it. Those jobs will disappear in that small town, that rural area, even in the the big cities. I just hope that our friends on the other side study this very carefully. This is a roundhouse blow to the Reid plan, to the Reid-Obama plan. This really, in my judgment, proves beyond a shadow of a doubt that this is going to crush health care in our country.
I would ask the senator from Wyoming and Georgia who are here, let's just go back to the very beginning. When we began this debate, the president in his summit at the beginning of the year, very correctly, and I applauded him for that, all of us said, we've got to reduce health care costs. Cost to us, cost to small businesses, and cost to our government. But doesn't this report of the chief actuary of the government say the Reid bill will actually increase health care costs?
Well, it does say that, and so much of what the president said is he said he wanted to bend the cost curve down. This report says that if we do